What if I told you that most people worried about monkeypox are afraid of the wrong things, and that understanding what the CDC actually says could instantly reduce fear and help you protect yourself the right way? Today we're breaking down CDC monkeypox guidance in clear, simple language. No panic, no hype, just facts that matter. Why this topic still matters. Over the past few years, monkeypox, now officially called Mpox, has moved from being a rare disease in specific regions to something that made global headlines. And when the news cycle moves fast, misinformation moves even faster. That's why today we're focusing specifically on CDC monkeypox guidance, what the experts actually say about transmission, symptoms, prevention, and vaccines. This isn't about fear, it's about clarity. Let's start from the beginning. What is monkeypox, Mpox? Monkeypox is a viral infection caused by the monkeypox virus, part of the same family of viruses as smallpox, but much less severe in most cases. The Centers for Disease Control and Prevention, commonly known as the CDC, describes monkeypox as a disease that can cause fever, headache, muscle aches, swollen lymph nodes, and most notably, a rash that can look like pimples or blisters. Unlike many other viral illnesses, the rash is a key feature. It may appear on the face, hands, feet, chest, genitals, or inside the mouth. The illness typically lasts 2 to 4 weeks. Most people recover fully, especially if they are otherwise healthy. But here's the important part. Severe cases can happen, particularly in people with weakened immune systems. So this isn't something to ignore, but it's also not something to panic over. How does monkeypox spread? This is where confusion often starts. According to CDC monkeypox guidance, the virus spreads through close contact. Not casual contact like passing someone in a store, but prolonged, direct exposure. Transmission happens through skin-to-skin contact with the rash or scabs, contact with body fluids, respiratory droplets during close, prolonged face-to-face contact, touching contaminated clothing, bedding, or surfaces. Let's be clear, this is not as easily spread as viruses like COVID-19. The CDC emphasizes that close physical contact is the primary driver. That means awareness of personal interactions matters more than general public fear. And that leads to an important mindset shift. Who is at risk? The CDC has consistently stressed that monkeypox can affect anyone, regardless of gender, age, or orientation. However, during recent outbreaks, certain networks with close physical contact saw higher case numbers. That doesn't mean the virus targets a specific group. It means viruses follow patterns of contact. The key risk factors include close, prolonged skin-to-skin contact, intimate contact with someone who has symptoms, sharing bedding, clothing, or towels with an infected person, travel to areas with active outbreaks. Understanding risk is not about labeling people. It's about recognizing behaviors that increase exposure, and that knowledge gives you power. Symptoms: what to watch for. CDC monkeypox symptom guidance highlights an important timeline. Symptoms typically begin 5 to 21 days after exposure. The illness often starts with fever, chills, fatigue, swollen lymph nodes. Then comes the rash. The rash goes through stages: flat spots, raised bumps, fluid-filled blisters, pustules, scabbing. The scabs eventually fall off. A person is considered contagious until all scabs have fallen off and new skin has formed. If you ever notice an unexplained rash, especially with flu-like symptoms, the CDC recommends contacting a healthcare provider for evaluation. Early testing reduces spread. And that brings us to something many people don't fully understand: testing and diagnosis. The CDC monkeypox testing protocol focuses on laboratory confirmation. A healthcare provider swabs the rash and sends it to a lab for analysis. This is not a blood test. It's a direct test of the lesion. If confirmed, Most cases are managed at home with isolation and symptom relief. Severe cases may require antiviral treatment. The key takeaway? Early recognition protects others. And now let's address the question many people ask. Is there a vaccine? CDC Monkeypox vaccine guidance. Yes, the CDC recommends vaccination for people who have been exposed or are at high risk. The primary vaccine used in the United States is Jynneos, which is specifically approved for prevention of monkeypox and smallpox. Vaccination can be used in two ways. Post-exposure prophylaxis, after known exposure, ideally within 4 days. Pre-exposure prevention, for individuals at higher risk. The CDC does not recommend mass vaccination for the general public. That's important. Vaccination strategy is targeted, not universal, because the virus spreads mainly through close contact networks. This is a measured response, not a panic response. Treatment options. Most people recover without antiviral medication. Supportive care includes pain management, hydration, rest, protecting skin lesions. For high-risk individuals, antiviral medications such as tecovirimat may be used under CDC guidance. The CDC works closely with state health departments to ensure medications are available when needed. Again, context matters. The majority of cases are manageable, but awareness prevents complications. Common myths about CDC. Monkeypox guidance. Let's clear up some misinformation. Myth number 1. Monkeypox spreads easily through air like COVID-19. False. Prolonged close contact is typically required. Myth number 2. Only one specific group can get monkeypox. False. Anyone can contract it through close contact. Myth number 3. It's always deadly. False. Most cases are mild to moderate. Myth number 4. The CDC is hiding information. There is no evidence of this. CDC guidance is publicly updated and transparent. Fear spreads faster than viruses. Facts slow both down. How to protect yourself. The CDC monkeypox prevention strategy is straightforward. Avoid close contact with people who have an unexplained rash. Do not share bedding, clothing, or personal items. Practice good hand hygiene. Consider vaccination if you are at increased risk. Stay informed through reliable public health sources. Protection doesn't require paranoia. It requires awareness. The bigger picture. Why public health guidance matters. Here's something powerful to understand. Public health agencies like the World Health Organization and the CDC don't create guidelines randomly. They analyze data, track case patterns, and update recommendations as evidence evolves. Guidance changes when data changes. That's not inconsistency, it's science. And staying informed doesn't mean living in fear. It means being prepared. What this means for you. If you're watching this wondering, should I be worried? Here's the honest answer. For most people, the risk is low. But informed awareness is smart. You don't need to isolate yourself from the world. You don't need to panic buy supplies. You need knowledge. And you need to recognize symptoms early. That's it. Clarity over chaos. CDC monkeypox guidance is clear. Understand transmission. Recognize symptoms. Seek testing if needed. Use targeted vaccination when appropriate. Stay informed. Public health works best when people are calm, informed, and proactive, not reactive. And that's what we aim to help you become. If this breakdown helped you understand CDC monkeypox guidance clearly and without fear, hit that like button so more people can see accurate health information. Subscribe to Balanced Motion Health for weekly, evidence-based insights that empower you, not scare you. And in the comments, tell us, what health topic would you like us to break down next? Because your health isn't just about reacting to headlines, it's about building knowledge that lasts.